and welcome to Navdaq and Your Wealth. My name is Tosin Omolaja, and here's where we bring you up to date with Navdaq's activities with regards to its mandate of safeguarding the health of the nation. Thanks for joining us for another insightful edition of the program. The National Agency for Food and Drugs Administration and Control came into being with the backing of the Nigerian law in 1993. It was established by Decree No. 15 of 1993, later amended by Decree No. 19 of 1999, and now the National Agency for Food and Drug Administration and Control Act of the Federal Republic of Nigeria 2004. In essence, the agency is lawful and is under the control of the executive arm of government and under the supervision of the legislature. On the program today, we join the Director General of Navdaq as she plays host to the House of Representatives Committee on Health on the committee's oversight visit to the headquarters of Navdaq.
Thank God for the Senate Committee on Health, and in particular, I would like to thank Honorable Sununu for taking it upon himself to ensure that what is good for Nigeria is what should be our focus. Because I don't think I've met Dr. Sununu for more than 2 weeks or 3 weeks before he knew that if Navdaq is not strong, the universal health care in Nigeria will be faulty, will not be strong. So I want to thank the committee for the very hard work that you have done over Navdaq. A lot of things have happened because of the commitment of this committee.
And immediately committee saw in action. We have tried to identify what are the problems. As at that time, there was issue with funding. We have worked tirelessly together with the management committee to ensure that more funds come to Navdaq so that it can carry out its constitutional mandate. As at today, the Navdaq, as I'm aware of, has done so much in terms of improving the strength of their laboratories, office with some state that have been used as residential initially. The goal is for the Navdaq to move in our global benchmark ranking so that Navdaq can match any other regulatory body, not only in Africa, but all over.
The outbreak of the COVID-19 pandemic in 2020 was a period that taxed the credibility and efficiency of Navdaq. In spite of the daunting challenges posed by the period, Navdaq remained undaunted in all ramifications. The agency had all hands on deck to safeguard the health of Nigerians. This is also not unconnected with the huge support and assistance of the committee.
Not only that the Navdaq has received its own budgetary allocation, we also ensure that during the COVID intervention, the organization receives a lot of funding so that it can perform its duties. And this has really yielded growth because Nigerians are now committed to receive vaccine because it has been certified locally to be safe. In practice, we can use the experience of tutors and we call them level 4 evidence.
The growth and efficiency of Navdaq under the leadership of Professor Mojisola Adeyeye has been exponential. This is being made possible through the ingenuity with which she has revolutionized the agency. However, our ingenuity would not have soared without the support of the legislature and in particular the House of Representatives Committee on Health.
I just want to say thank you to the Ninth Assembly again. I cannot say thank you enough because things have changed. You have made us to be at ease to do our work. And that is all that we need. Thank you for your support. To ensure that what is good for Nigeria is what should be our focus. like the Honorable Sununu said, through this committee, we have had funding for the vaccine lab. Without a strong vaccine lab, Navdaq will not be strong. Without Navdaq being strong, we will never be able to manufacture vaccine in Nigeria. Aside from that, through this committee and Honorable Michelia's COVID intervention committee, we were able to also get money for equipment, which the procurement has gone through fair. We have the pieces of equipment now. And the vaccine lab is being built in Oshodi as we speak. So to say that this is a committee that is at work, that is functioning, yes, this is the committee that is working to ensure that Nigeria is kept safe and the health of our people is protected. So I want to say thank you very much to everybody, and I mean it.
Professor Mojisola Adeyeye has made accountability and transparency the bane of her leadership in Navdaq. These qualities have always been made manifest in all the agency's activities since she assumed office.
Our revenue comes in two streams. That is how I met the classification. Internally generated revenue, which is called IGR, and then the user fees. The user fees are the things that the sponsors, applicants, pay for us to do A, B, C, D, E tests in order to approve or not to approve their product. The IGR includes sales of registration form, administrative charges, fines, things like that. And user fees are supposed to be used exclusively for inspection of factories to ensure that manufacturers are compliant, to buy vehicles, to ensure that we have vehicles to go for the inspection, to digitalize our processes, a requirement for a company, for a registration, for an agency to be classified as mature, and for laboratory analysis. Navdaq is thought to be an income generating agency, but we are not, because we use the money to do XYZ for the client. The user fees are fees for services provided during the product approval processes. The money cannot be used for any other activities. The IGR that is composed of administrative charges and fines are used for control of our regulatory procedures that are not anticipated. For example, we seize products. We seize illegal products. We seize tramadol. We have to destroy it. We don't know at the beginning of the year how many containers we're going to seize. But we have to destroy during the year. So those are the types of unexpected fees or activities that we spend money on. Enforcement, that is another thing. Somebody is falsifying something somewhere, our enforcement has to go, and they walk around the clock. As you can see, for the summary of the budget performance for years 2020 and 2021, we start with the government allocation. The government gave Navdaq or allocated to Navdaq 129,364,056 naira in 2020. The money that was released was 42 million or 42.7 million. Please indulge me to use some approximations. We used 42.3 million of the 42.7 million. Our performance was 99%. That is for capital projects. 129 million was appropriated, 42 was released, 42 was used. Our performance was about 99. For 2021 up to date, actually up to June, sorry, we had an appropriated budget of 3.5 billion naira. The IGR generated is thus far is 2.1 billion naira. The performance thus far is 59.9%. For the user fees, what was appropriated for us was 13.6 billion naira. What we have thus far, up to June, was 7.5 billion naira. Our performance is 55% performance. That is for the IGR user fees. In terms of our expenditure for 2020, out of the 15.6 billion naira total that was appropriated for us, we've been able to utilize 6.5 billion naira. The performance is about 41.6%.
We'll take a short break now. Don't go away.
The MedSafety app is the latest reporting tool introduced by the National Agency for Food, Drug Administration and Control in November 2020 as part of the Innovative Medicines Initiative project. The app is made available to the public in collaboration with World Health Organization, Uppsala Monitoring Center, Medicines and Healthcare Products Regulatory Agency, UK, and National Agency for Food, Drugs and Administration and Control, Navdaq. The MedSafety app allows users to track safety information of medicines, vaccines and other health products, report adverse drug reaction to a medicine or vaccine, and view data on suspected side effects. When you have received your COVID-19 vaccine, you can use the MedSafety app to report any adverse reaction or side effect you may feel. The app can be used by anybody, irrespective of whether you are a medical practitioner or not. You, your family and friends, everyone can download and use the MedSafety app to report adverse drug reaction. Just search for MedSafety on Google Play Store for Android and App Store for iOS. When using the app for the first time, the user needs to select his or her region, in this case, Nigeria, and also choose the preferred language of choice. The user will then be taken to the login page where you create an account by providing your email and password or proceed as a guest. To create an account, you are required to provide the following details: reporter type, example, physician or pharmacist, as well as their name and email address, password with at least 9 characters with 1 uppercase letter and a number. Read the privacy statement and accept. Once you are logged in, the user is presented with a number of tabs, which includes news, products and watch lists. Under the Report tab, the user can report a new suspected adverse drug reaction, ADR. On opening a new report, the user is prompted to impute patient details, which include initials, sex, and date of birth. The user is then required to input details of the suspected medicine. These include suspected medicine name, other drug details such as strength, batch, dosage details. Multiple suspect drugs and concomitant drugs can be added at any time. The report can be saved and completed at a later time. A saved report can be found on Pending Reports and can be continued by clicking on the report and continuing from where the user stopped. Enter reaction details, reaction date and outcomes. Multiple suspects' reaction can also be added. Also, further details about the report can also be included, such as did the reaction cause prolonged hospitalization, disability, congenital anomaly, or birth defect, life-threatening results in deaths, and so on. Finally, you can also add details of any relevant medical history before submitting the report. The user receives a message on the app confirming submission and an acknowledgement in the mail for submission. Reports can be created and saved without internet connection and be sent whenever internet connection is available. The product tabs show all medicines in the Navdaq list database. It's easier to navigate to a drug or vaccine of interest, and this data is obtained from the WHO Uppsala Monitoring Center. User can also add products of interest to their watch list to get the latest information on the drugs. All products added to the watch list can be viewed in the Watch List tab. The News tab displays drug safety information by Navdaq. This is usually up to date with drug safety information. Registered users can also edit their profile or change app settings. For more information on the app, please contact the National Pharmacovigilance Center (NPC) at Navdaq Headquarters, Plot 2032, Olusegun Obasanjo Way, Wuse Zone 7, Abuja, or call 09290511110 or send email to medsafetyapp@navdac.gov.ng or pharmacovigilance@navdac.gov.ng.
Welcome back. If you are just joining in, you're watching Navdaq and your health. Irrespective of the unprecedented and impressive performance, there is still a cog obstructing the desired service delivery of Navdaq, which needs very urgent attention.
We have a peculiar case, and this is where I will call on my honorable members, the chair, and this also has been noted at the Federal Executive Council that Navdaq's procurement can take 8 to 10 months. If you look at our platform, relative to 15 billion that was appropriated for us, people will say, oh, Navdaq has money. No, Navdaq doesn't have money. It is that our procurement goes through snail speed. 8 to 10 months to approve at the FEC level. And people are waiting to get their products approved. So that is part of our problem in terms of the slowness, or what appears to be slowness on this particular, on paper, but actually it is what is happening.
If that is hampered, then I think the responsibility, because there is money, but there is slow pace in getting approval to carry out that mandate, as a representative of the people who must act to ensure that we are protected. And the honorable members, before we go, at this meeting we have to approve the motion, if it's possible, for us to ensure that all the necessary stakeholders are invited to find the reason why a cash-backed procurement will take more than 1 year to get it done. I think it's not acceptable, and it's not in the best interest of this country.
Yes.
Yes. So I think before somebody will move the motion, and then secondly, I also want to thank members of this committee for diligently working to ensure that the Navdaq Act was amended and successfully passed by the House of Representatives, which is currently in the Senate for concurrence. And already myself and my deputy jointly are sponsoring the amendment of Counterfeit, Fake Drug, and Compulsory Product Act. It is our hope that that also will see the blessing of National Assembly and the Assembly of Mr. President, so that this country will be protected. It will be all good for us to see that we left Navdaq better than the way we made it. Yeah.
My chair, my colleagues, the DJ and our team, I beg to move that this honorable committee should review the procurement processes of Navdaq through the Ministry of Health and come up with solutions to available challenges. I so move.
Thank you, Chairman. I respected colleagues. I so second the motion as moved by the Deputy Chair.
Not because of
The slow pace of processing and award of contract of Navdaq. Both the internal and external say aye.
Aye.
Those who oppose the motion say nay. The ayes have it. It's resolved here that the
On behalf of our constituents, the Nigerians, we just want to say thank you for the good job. And we want you to continue to put in the best, irrespective of the distraction, left and right. Please continue. with the good work you are doing, you and your team.
With the motion moved and seconded, and with the majority of the House of Representatives Committee on Health in agreement that Navdaq, under the leadership of Professor Mojisola Adeyeye, will no longer experience the bottleneck hitherto experienced in the approval of its procurements, a better positioned Navdaq for a better service delivery is guaranteed. Time now for Navdaq Updates.
Navdaq clamps down on dealers in fake beverages. Officials of Navdaq recently swooped in on dealers in fake beverages at Okeari Market, a popular market in the heart of Lagos where beverages are sold in wholesale. It was quite a busy day for Navdaq officials as several of the shops where beverages are sold had fake beverages in large quantities, while many of the shop owners were apprehended and their shops put under lock and key pending further actions by the agency. The officials also seized the opportunity to enlighten those who are curious on the purpose of their exercise on the dangers the fake beverage dealers subject unsuspecting buyers to.
These vegetables are orange. Then there are certain nutritions that the agency said they contain. Look at it. They're not there. Zero. I think we use it to create. So we are here for non-compliance regulated, Navdaq regulated products.
Navdaq's mop-up train hits Enugu. The coming of stalls where Navdaq's regulated products are sold recently took place in the city of Enugu, with many of the stalls having either products without Navdaq approval, Navdaq registration number, or substandard and expired products on their shelves. Some of the traders whom the visit of Navdaq officials caught unawares feigned ignorance of the fact that the products were not fit to be sold. Such alibis are not tenable before the law, as sellers are expected to be sure every regulated product they display for sale are in compliance with Navdaq rules and regulations. Punitive measures were therefore taken on the traders to serve as deterrent to others. That's it on Navdaq Update. You've been updated.
That's our package for today. Please join us again, same time, same station, next week for a fresh edition. In the meantime, if you have comments, complaints, or you want to report activities of fake drugs or adulterated food product peddlers in your area, our doors are always open. You can reach Navdaq via toll-free numbers. For inquiries, call 0700 162 3322. For complaints, call 0800 162 3322. You may also email Navdaq at navdaq.gov.ng. If you have complaints about any form of misconduct, you can reach the Reforms Unit via email reforms@navdaq.gov.ng or call the Reforms hotlines on 0909 763 0506 or 0909 763 0507. Navdaq, customer focused, agency minded. COVID-19 is real. Please ensure you and your family follow safety measures as outlined by the NCDC. Stay away from crowded places as much as possible, and if you must be out there, please wear a face mask. Wash your hands regularly with soap and water, and ensure you use only Navdaq-approved alcohol-based hand sanitizers. Taking the Navdaq-approved COVID-19 vaccine is safe. It's our best bet of stamping out the deadly coronavirus. And don't forget to download the MedSafety app from iOS or Play Store to report any adverse reaction from the vaccine or any other medicine at all. See you next week. Stay safe.